2 sets of papers here, and we're not going to cover it. We're not going to cover these papers verbatim or like word for word in order. But this is just your basic written information, along with some videos and some links that you can use. This CD, for those of you who may have been here before, this CD, these are actually the audio, these are the meditations. And we'll talk, these are cut the killer carbs meditations, and it's a way to change your diet by kind of reprogramming your subconscious mind to help take some of the willpower out of changing what you eat on a daily basis. And then there's some information from our other non-monetary sponsors, including Veritas Medical, Dr. Ben Edwards, who is here in town. We'll talk about him. Chiropractic evaluation for you and your family from Dr. Helton. He will speak in the second hour. And then this is some of the products that are available from the natural health market here in town. So that's everything in the handout. Let's see if the remote control works. Oh yes, and the medical disclaimer. And I'm going to read this verbatim to make all the lawyers happy. It says the material in this presentation, the audio CD, and materials and/or the printed material is for informational purposes only. It's not intended as a substitute for the advice and care of your physician. And any new lifestyle program is outlined in the printed material, audio CD material should be, or in the presentation should be followed after first consulting with your physician to make sure it's appropriate for your individual circumstance. And this is true. You really should check with your doctor. It's important to check with your doctor because there are people who have some medical conditions where they can't really tolerate a high protein diet or a high fat diet, or they a diet that's high in iron. You know, if you have I don't know if you have polycythemia or some kind of strange condition, so you should check with your doctor. And the author and publisher disclaim responsibility for any adverse effects that may result from the use and application of the information contained in this presentation or the audio CD materials and or the printed material. And so now all of the attorneys are happy. So this is me. I'm Dr. Anderson. I'm a physician here in town. I'm an ophthalmologist. But I don't want to be your doctor. I want you to have as few doctors as possible, and I really want you to be as healthy as possible. And so that's what this conference is about. It's about being as healthy as you can, taking as few medications as you can through the use of diet. And there's something in America that in the last 30 or 40 years is really making us sicker, because we have an epidemic in this country of obesity. And going along with obesity and overweight is, in addition to obesity and overweight, you can check in right at the desk in the back. There's an epidemic of heart disease. Patients have tons of acid reflux. You see the commercials on TV for today's purple pill. High blood pressure, cancer, sleep apnea, diabetes. All of these things have been on a dramatic increase in the last 30 or 40 years in this country. This is a graph that shows the obesity prevalence. Obesity BMI over 30 really takes off in the 1980s, and morbid obesity is taking off as well. But that's not the only problem. It's not just about weight, it's also about diabetes. And in the last 30 years, diabetes has been really on the increase too, starting off in the 1990s. In fact, obesity and diabetes tend to go together. And the CDC, from this graph, estimate that 1 in 3 to 1 in 5 Americans is going to be diabetic by 2050. And the other things that have been really on the increase lately, bowel problems, chronic constipation. You've all seen the commercials for irritable bowel syndrome on TV now. There was no such thing as irritable bowel syndrome 10 years ago. Gastroesophageal reflux, that's another bowel problem, and immune problems like Crohn's disease. But really, diabetes and weight are just the tip of the iceberg, because most Americans, most of us today, we suffer from this problem, which is insulin resistance. And insulin resistance is the inability of your body to respond to the insulin that you produce. And in addition to the insulin resistance, there's hyperinsulinemia, which is too much insulin in the blood. Central obesity just means you're rounder around the middle than you are at the hips, along with bad blood lipids and hypertension. And in fact, all of these symptoms go together to make up something called metabolic syndrome. And the metabolic syndrome, you have to have 3 of these things to be diagnosed with the metabolic syndrome. So you can have metabolic syndrome and actually be normal weight, totally normal weight. If you have elevated blood sugar, elevated triglycerides. And there are other interesting diseases that are all popping up at the same time that are modern epidemics. This NAFLD is non-alcoholic fatty liver disease. It's patients whose livers get packed with fat. They have fatty liver. But they're not, they call it non-alcoholic because the number one reason for people to get fatty liver disease is because of chronic alcoholism. But it can happen without alcohol. And it's from your diet. It happens from your diet. Inflammation and inflammatory disease. Polycystic ovarian syndrome. I don't know if you guys are familiar with that, but polycystic ovarian syndrome makes a young woman of childbearing age infertile. Polycystic ovarian syndrome is directly caused by diet, and it can be reversed with diet. GERD, which is acid reflux, we talked about. Depression, osteoporosis, and Alzheimer's are related. And there's a whole group of cancers that have an increased, you're at increased risk of those cancers if you have either diabetes or you're overweight or obese. The good news is that a lot of these infectious diseases have been on the decline, but at the same time, these immune or inflammatory diseases have been on the increase, like multiple sclerosis and Crohn's, asthma, and type 1 diabetes is actually an autoimmune disease that causes type 1 diabetes to start. And so what's happened is, over the past 30 or 40 years, most of us Americans have gone from being like slim, svelte, slender, healthy feeling, healthy looking youths to feeling a lot more like this. You know, some of us actually look like that, and lots of us have gotten to where we're feeling like that. But the good news is that if you change your diet, you can change your life, and you can get more back to feeling like this, like Americans were 100 years ago. So the question is, what's making us sicker? Anybody throw out an answer? What do you think? Food, fast food, processed food. Yeah, you're right. I mean, you're all right. What's making us sicker is our diet. But really, the good news is that even though our diet is the cause of what's making us sicker, that means that it's also the solution. That our diet can also be the one thing that makes us healthier. And so that's why we called the conference today, Change Your Diet, Change Your Life. And we'll go through what the change in diet is, number one, and we'll go through results that I've seen and that other people I know have seen as well. Just a reminder, things like obesity, overweight, and diabetes, those are just one symptom out of a whole slew of symptoms that all go together. All of these things are related to our diet. From a host of, these are like bowel problems, fatty liver disease, PCOS, and even asthma and allergies are related to our diet. And so the question is, name the disease. What is the one disease that would cause all of these things together? And that disease is carbohydrate intolerance. The problem is that we, modern Americans, we can't tolerate the amount of processed and refined carbohydrates in our diet. And we also can't tolerate the types of carbohydrates in our diet. There are some carbohydrates which are perfectly healthy and others which aren't. And we'll kind of go through that during the presentation. So what happens is this. We eat refined carbohydrates, which are like sugars, flours, wheat, and the refined carbohydrates are what stimulate insulin secretion. And it's the insulin in our diet that directly causes the high blood pressure. Not in our diet, excuse me. The insulin that we make in response to our diet is what causes the high blood pressure. The insulin is what causes us to grow fat. The insulin causes the obesity. And the insulin causes the diabetes. It's also a growth hormone. Insulin and diabetes are related to a lot of cancers. And these diseases that we've been talking about today, they're called the diseases of civilization. And that's because they're diseases that people who eat a Western diet or a standard American diet end up with. And they're not just diseases that make us sick with an average disability of 10 years. Average disability of 10 years from these diseases. They're also the ones that end up causing our ultimate death, including heart disease, cancer, stroke, Alzheimer's disease, diabetes, and kidney disease can be related as well. So let me introduce you to a concept that I came up with called the killer carbs. And I call them the killer carbs because, number one, they're making us sicker. And number two, they ultimately result in those diseases that most of us end up expiring from. And the first of the killer carbs are sugars and high fructose corn syrup. And I mean really any kind of sugar, whether it's raw, organic cane juice, maple syrup, agave nectar, or high fructose corn syrup that's found in a soda. Those sugars are actually processed like alcohol in the body. They're processed like a toxin. The other killer carbs that are surprising are wheat products. We're told all the time to eat more heart-healthy whole wheat. We're told about heart-healthy whole grains. And everything from breads to bagels and pasta to noodles, cakes to muffins and flour tortillas, the wheat actually, we'll go over this in the presentation, but the wheat causes most of the bowel problems that we suffer from. Wheat raises your blood sugar higher than table sugar. And wheat is one of the things that's making us sicker. Certain fruits are also very high in carbohydrates, and they raise your blood sugar and insulin levels, causing that whole insulin cascade of disease. Dried fruits are super high carb because they're concentrated, and fruit juices contain as much sugar in them, ounce per ounce, as soda. We've been sold the idea that fruit juices are healthy, but they actually have just as much sugar in them as a soda. So we give them to our kids because we think they're healthy, but you might as well give them a soda. Is that amazing? The other killer carbs, which raise your blood sugar, raise your insulin, and start that whole cascade of disease, are the rice, the cereal grains, and other starchy foods. Corn, mainly cornmeal, whole corn is actually fine, but things like cornmeal, which you use to make chips and tortillas, and potatoes. And we'll go over those in the presentation, what they do to your blood sugar. But the great thing is that if you cut the killer carbs, which means that essentially you cut the bottom right off the food pyramid, you just remove the wheat, the pasta, the grain, the bowl of cereal every morning, the bread in your meals, then you can get really great results and improvements in a lot of areas of your health. Because what you're doing is you're cutting that refined carbohydrate consumption. And if you don't consume the refined carbohydrates, then you stop this insulin secretion. And by stopping the insulin secretion, boom, you stop all of these things from happening at the same time. And so here's a question I'll throw out to the audience. What's an appropriate name for a food, something that we call a food, which actually causes all these diseases? I know some of you have seen the presentation from last year. Does anybody have an idea? Well, if I said I had a vial, I have a vial, and if you drink this vial, take it. If you drink this vial, it'll give you heart attack, high blood pressure, stroke, cancer, and ulcers. Just drink the vial. What would you say the contents of that vial are?
Carbohydrates.
Carbohydrates?
Wheat.
A killer?
Sugar.
What I would call the contents of that vial is poison. And the truth is that if you're struggling with your weight, if you're struggling with any of these diseases that we've mentioned, inflammatory, immune disease, blood pressure, all of those things, then these foods are a poison to you. And what I'm not saying that these foods are a poison to every human being on the planet. Because there are some people, there's a minority of people who are very carbohydrate tolerant, and they can tolerate large amounts of carbohydrates. But what I'm saying is that if you're suffering from these diseases of civilization, then these foods are a poison to you. And so we'll do my story. Here I am. I'm just making sure you guys can see. 3 years ago, my wife was kicking me out of bed, and she said, "Look," she said, "you're snoring too loud. I can't even sleep." And I knew that I was snoring too loud because I got too fat. And I just said, "Look," at that point, I remembered something from medical school. And from medical school, I remembered, if you don't eat carbohydrates, then all of your metabolism turns backwards. And so I said, I'm done. I'm done eating refined carbohydrates. I'm done eating sugar and flour. And what happened to me was, I was 213.5 pounds. My blood pressure was 142/88. And I lost most of the weight in 6 months. And here I am 3 years later. I'm 169.2 pounds. My blood pressure has dropped almost 20 points. My HDL, good cholesterol, has gone up to 76. I don't know what it was when I was actually that size, but I do know a year ago it was 42 and now it's 76. Normal HDL, that's your good cholesterol. And in medical school they teach us, oh, there's no drugs you can give people to raise their good cholesterol. The only thing you can give them is niacin, and it doesn't work that great. Well, normal good cholesterol is up to 71 and mine's 76. Triglycerides, which are another blood lipid, 48. Normal is 150 or less. And mine's 48. And hemoglobin A1C is just a measure of blood sugar. So, I cut the killer carbs out and I had these great results. And the question is, how did I do it? It was very simple. Remove the bottom off the food pyramid. All the breads, the pastas, the pancakes, those things went away. We still eat bread and pancakes and things like that, but we cook them a different way, and we'll talk about that in the second or third hour. But people always ask, if you don't eat bread or you don't eat cereal, then what on earth do you eat? You know, what is there still to eat? Well, you can eat a ton of meat, eggs, and fish, a ton of vegetables. You can eat all the berries that you want, some of the other fruits, because fruits are relatively high in carbs. A ton of nuts. Nuts are my snack. Cheese, healthy oils such as olive oils. And then if you do eat bread, the breads are way up at the top. Very seldom and very little. And this is from the Wheat Belly book. This is the Wheat Belly food pyramid. And it's the same thing, you know, meat, salami, healthy oils, healthy fats. All of the meat that you buy in the grocery store will contain the fat that you need in your diet. And you don't fear the fat. Fat is actually good for you. You can power your body with fat. Tons of vegetables and very few of the root vegetables like potatoes and none of the grains. So you take the average American diet, which is the average American diet, 65% of the food comes from carbohydrates. And you cut those carbohydrates off, and then what are you left with? You're left with a lot of things from the produce department, the meat department, and the cheese department. And in this today we're going to discuss what's called the LCHF diet, and the reason is I chose this diet because it's the best name. The diet can go by a lot of different names. They're all basically the same, which are cut the carbohydrates out of your diet. But LCHF really focuses on the two main things: low carbohydrate, high fat. Don't fear the fat. The fat is actually what you'll use to fuel your body. You'll actually eat fat and get slimmer. So what results can you expect with an LCHF diet? These are typical things, right? Weight loss in an older guy, weight loss in a younger lady. And it can happen at any age. Here's mom and daughter. And they lost the weight together. They did it together. But there are interesting things other than weight loss that happen by cutting the carbohydrates out of your diet. And for instance, acne, gone. Fatty liver disease, which we talked about earlier, gone. The fatty liver disease is caused by the carbohydrates in the diet. Metabolic syndrome, high blood pressure, gone. Sugar cravings, gone. Diabetes and high blood pressure, gone. And a low carbohydrate, high fat diet has been used to treat epilepsy since the 1920s. Seizure disorder. Metabolic syndrome, gone. Digestive issues like the irritable bowel syndrome, chronic constipation, gastroesophageal reflux, gone. Now, all of those stories I just showed you, that they came from the dietdoctor.com website, which is on the internet. So anybody can publish anything they want on the internet. And I wouldn't believe it if I hadn't seen these things for myself in real life results. Other than my story, this is my wife, and here she is 7 months pregnant. And pregnant women tend to get a lot of indigestion. And what we were taught in medical school is that you get indigestion because as the baby expands, the baby takes up the space where your stomach's supposed to be, and so you get reflux, pushes reflux up. And so we read the book Wheat Belly 7 months into her pregnancy, and she said, well, look, let's cut out the wheat from our diet because it causes some acid reflux. And as soon as she cut the wheat, the reflux went away completely. She was living off Tums and Mylanta, and just overnight, gone. And so, for me, it was a miracle because what happened to her was 7 months pregnant. When she got 8 months pregnant, still no more indigestion, no more reflux. When she got 9 months pregnant, no more indigestion. It was totally gone. And what convinced me that it was certainly the wheat was that several months after the baby was born, she had a cookie, which just came from the bakery, a cookie made out of wheat flour, and instantly the indigestion was back. So, I'm 100% convinced that it is the wheat that causes the indigestion, which causes millions of Americans to take today's purple pill every day. Gestational diabetes. If she ate a healthy bran muffin from United Market Street, her blood sugar would be through the roof. And so we cut the bran muffins out, cut the wheat out, gestational diabetes, gone. And then finally she could get back into her pre-pregnancy genes after 3 kids. So we have an assumption in our culture that as you get older, you get sicker. You get sicker, you might get bigger, but you don't have to. You don't have to. You may not perform as well as you did 20 years ago, but you don't have to be sick. This is another story. This is my son, and he had developed these chronic nasal allergies. He would sneeze, and every time he would sneeze, the snot would come from his nose all the way down to his waist. And it was like that for months, probably 3 months, and it wasn't normal. So we made an appointment with the allergist, but before we saw the allergist, we read wheat belt and we cut the wheat out of our life. And when we cut the wheat, his sneezing and his chronic allergies, gone. And the way I know it was the wheat is that if he goes to a birthday party and has a chicken nugget, for 3 days, the sneezing comes back. And he's full of snot, he's congested, he blows his nose 20 times an hour, and until the wheat gets out of his system. And in addition to those 2 stories, in addition to my story, there are other people that I know, some people that, as soon as I discovered this, I started telling everybody, right? And so I have a friend, diabetes medication's gone, chronic digestive problems gone, nasal allergies gone, nighttime sneezing gone, chronic inflammation of the eye gone, high blood pressure, medications gone, off the medications. Chronic irritable bowel syndrome, gone. Poor exercise performance, gone. PCOS, PCOS gone, and pregnant. Which is just amazing, for a young woman of childbearing age. She wants to have a family and she can't do it. You change your diet, you can get rid of the PCOS, and you can have a normal pregnancy. So I was convinced by my results. I just thought this was the most amazing thing. I thought I discovered the best thing since sliced bread. And so I wanted to go out and tell the world. I wanted to do a speaking tour and write a book and tell everybody that I knew about this. And I wanted to tell all the doctors I knew about this too, because you can get patients off of a lot of medications. There's tons of my patients who come in, they're on 15 prescription medications every day. And it's like that month after month and year after year. And they can get rid of a lot of those medications if they had the information and could change their diet. But I wasn't the first one. And a lot of people ask me, they say, if this is true, then why aren't doctors talking about it? If it's true, that why would my doctor give me a blood pressure pill and then give me a diabetes pill and give me a cholesterol pill if one change in my diet would eliminate all of those pills? And that's a good question. Does anybody recognize this guy?
Buddha.
Yes, they're Buddha. Very good. Buddha. And behind Buddha is another guy. He looks more like, this is a more recent picture. This is Dr. Atkins. This is Robert Atkins, and this is his picture from his original 1972 book, where he taught a low-carbohydrate, high-fat diet. What happened to Dr. Atkins was he was a middle-aged cardiologist who had gotten overweight, and his health was suffering. He discovered low-carbohydrate, high-fat diet, and he was so excited about it, he wrote a book and started prescribing it to all of his patients and all of his cardiac patients. This is a more recent book. This is Dr. Annika Dahlquist. She's a doctor in Sweden. She was middle-aged, got overweight, had bowel problems and some sleep problems. She got on the low-carbohydrate, high-fat diet, and then she began to prescribe it for all of her patients. And she's the founder of the LCHF diet in Sweden. And she was so successful that 2 dietitians in Sweden, they turned her into the national health authorities, and they said, you can't tell people to eat that much saturated fat, you'll kill them. And so what she did is, the Swedish government, they investigated her for 2 years. And after 2 years of reviewing the scientific evidence for low-carb, high-fat diet, they came up with this statement, 2008. The low-carb diets can today be seen as compatible with scientific evidence and best practice for weight reduction in patients with overweight and type 2 diabetes. As a number of studies have shown effect in the short term, and no evidence of harm has emerged. And so she was vindicated, and she kept treating her patients that way, and she's a speaker. So she's out speaking in public about the LCHF diet. This guy is Dr. Jay Wortman. He's a physician in Canada who was diagnosed with type 2 diabetes. And when he was diagnosed, he had been out of practice for a while. And he said, look, I've got type 2 diabetes. I don't know which medication to take. I'm going to research the best medication to take. But I don't want my sugar to be too high while I'm researching. And so he said, I know carbohydrates cause high blood sugar. He cut the carbohydrates out of his diet. And while he was researching which medication to take, and guess what happened? His diabetes went away. But he said it never occurred to him that he could just recommend to his patients that they change their diet to treat their diabetes when he was practicing. And I recommend you watch this movie called My Big Fat Diet Canada. It's a documentary. And also How to Cure Type 2 Diabetes. I think they're both listed in your handout. If you're taking notes on the back of the comment form, don't take notes on the back of the comment form because I'll ask you to hand that in at the end. Sorry. This is one of Dr. Wortman's patients who started out on high blood pressure medicine, diabetes medication, insulin shots, and within 18 weeks he had lost 46 pounds. Blood sugar, normal. Blood pressure, normal. Cholesterol, normal. All on no medications by doing low carbohydrate, high fat diet. And the interesting thing is that people say, well, that's great, but you can't sustain that. And in my case, it's been 3 years. I've kept the weight off, the blood pressure down for 3 years. And in this guy's case, it's been 8 years. 8 years later, normal blood pressure, normal blood sugar, no medication. This guy, Grant Schofield, he actually gives a speech in the internet where he apologizes for being in public health for 20 years and recommending low-fat diets for 20 years. Because he's seen how low-fat diets have hurt a lot of people's health, and he switched over and he's now an international speaker for low-carb, high-fat diet to prevent public health diseases. This guy, Troy Stapleton, he was diagnosed with type 1 diabetes. He's another doctor. And as soon as he was diagnosed with type 1 diabetes, they sent him to the dietitian, and the dietitian said, look, you need to eat what's the American Diabetes Association diet. You start at 240 grams of carbohydrate per day. And just use your insulin and your medications to chase your sugar. If you eat more carbohydrates, you use more insulin. If you eat less carbohydrates, you take less insulin. And what happened was he could only get his hemoglobin A1C, which is a measure of his 3-month insulin, down to 7.2, which is actually pretty good for a type 1 diabetic. But he could only get it to 7.2. And what he ended up doing was switching to low carbohydrate, high fat diet. He brought his hemoglobin A1C from 7.2 to 5, which is normal. That's normal hemoglobin A1C, and the best part was this. When he was eating the carbohydrates and had a hemoglobin A1C of 7.2, he was having low blood sugar episodes once a week. And low blood sugar episodes are dangerous because you can go into a seizure when you have low blood sugar if you don't catch it and eat something. When he switched to low carbohydrate, high fat diet, he lowered his blood sugar, but he only had a hypoglycemic episode. He only had a low blood sugar episode once a month. So he went from once a week to once a month. His blood sugar essentially evened out a lot better. And the way that he did it was he read books, such as The Art and Science of Low Carbohydrate Living. It's an excellent one. Why We Get Fat, Sweet Poison, which is about sugar. And by educating himself, he was able to take control of his health. And this guy, Tim Noakes, in the United States, the Atkins diet is called the Atkins diet. And in South Africa, the Atkins diet is called the Noakes diet. He's a sports physician, or a professor of sports nutrition, who he preached high carbohydrate diets, carb loading for endurance athletes for probably 30 years. And then he got middle-aged. He had a personal experience where he developed diabetes. He got rid of his diabetes by changing his diet, improved his lost weight by changing his diet. And so now he's a speaker that promotes low carbohydrate, high fat diet. And the same thing for Ralph Sundberg. He's another Swedish doctor. This guy is Dr. Eric Westman. All the people I've shown you before, they had a personal experience. But Dr. Eric Westman, he's a doctor at Duke who had a patient who came in, diabetic, hypertensive, came in off of his medications, his diabetes was gone, and his blood pressure was gone. And Dr. Westman said, well, what did you do? And the patient said, I got on the Atkins diet. And Dr. Westman said, look, this isn't possible because you don't cure diabetes. You don't cure high blood pressure. You treat it. But he got to reading the Atkins book, and he became such a sold-out believer that he's now the author of the latest Atkins book. And he's also involved with bariatric physicians and weight loss, and he runs a lifestyle medicine clinic at Duke. You guys have the time? 9:36. This is, anybody recognize this guy's face? He's been in the media more recently, past couple of years.
I've drawn like baby employment to be belly.
You're right, it's Dr. William Davis. He was middle-aged diabetic. It's the same story over and over. The doctors who get convinced that low carbohydrate, high fat diet are the ones who have a personal experience. The ones like me. And the doctors who don't tell you about it are the ones who have not had a personal experience. And he became so convinced that he wrote the book Wheat Belly. Dr. Robert Lustig, he transforms children's lives by cutting out the sugar. Because biochemically, sugar, table sugar, is metabolized like alcohol. And you should watch his video, Sugar, the Bitter Truth. It's also in your handout. And this points out the problem with fruit juices. He takes kids off fruit juice. He says, children, the only thing that his kids can drink, that he treats, the kids he treats for childhood obesity, childhood diabetes, childhood high blood pressure, the only thing they can drink is water and milk. And the problem is this, that apple juice or fruit juices, ounce for ounce, have exactly the same amount of sugar in them as a soda. This is a 20-ounce soda. That's a 16-ounce juice. So this one has slightly more because it's more volume. But ounce per ounce, they're the same. And that brings up the question, well, what about fruit? If fruit juice is bad, what about fruit? Fruit is actually okay because fruit has relatively less sugar. You have to juice like 5 apples to get a pint of apple juice. And so most people aren't going to sit and eat 5 apples at a time. So you eat less fruit. Fruit has relatively less sugar, and the sugar is bound up within the cells and within the indigestible fiber of the fruit. So it's not, the fruit itself doesn't raise your blood sugar nearly as high as fruit juice. Does anybody know this guy? Yeah, Ben Edwards. Exactly. Who said Ben Edwards? Yeah, okay, yeah. Dr. Ben Edwards, he saw one of his staff members' lives transformed by probiotics, digestive enzymes, and he got turned on to this whole side of medicine that involves diet, probiotics, lifestyle, and he now treats patients at the Veritas Clinic. You can make an appointment with him by getting to the root of the problem. The root, he uses a low carbohydrate, high fat, anti-inflammatory diet along with probiotics, digestive enzymes, and some other therapies. And there's other doctors and dietitians. Karen Zinn, Dr. Peter Bruckner, Dr. Zishan Rain, Diane Sanfilippo. They're all international speakers who go out and speak on low carbohydrate, high fat diet. So what I'm trying to tell you is that the truth is that doctors can't stop talking about this. If your doctor hasn't told you about a low carbohydrate, high fat diet, it's because he hasn't had a personal experience with it, either himself or with his patients. But most of these books were all written by physicians. Life Without Bread is written by the Wheat Belly. Grain Brain, which is the most recent, written by a physician. And this book up here at the top, The Physiology of Taste, that's by Jean-Briand Savarin, who's a French guy, written in 1825, saying that carbohydrates and cakes and that sort of thing are the things that are making us overweight, destroying our health. And this book here, the second one is William Banting, The Letter on Corpulence. And you can just get it for free off the internet and read it. William Banting's Letter on Corpulence. It was written in the 1860s, The same thing. His doctor told him, cut out the bread and the potatoes, the things that he thought were healthy, staples of his diet, in order to lose the weight. And just like these other stories, he had other problems like boils. You know, I don't know, I guess a lot of people had boils in the 1860s, but I don't know if that's acne or what that is, but it went away. The other medical problems improved. And so most of these books are listed in your handout as well. Let's do some questions.
I have a question.
Yes, ma'am.
Whenever you, I noticed when you listed your, numbers and stuff, you usually address the HDL, but not the LDL. And I was just curious
Okay, why not address the LDL?
about those.
Because the latest in cholesterol science says that LDL level, your LDL number doesn't matter. What matters is your particle size. So my LDL, LDL is typically called your bad cholesterol. My LDL has gone up, but my particle size is all large. And this is the thing: is that your regular medical doctor is going to measure. Your regular medical doctor is just going to measure your LDL number, but he's not going to measure your particle size. So I paid $99 to send my blood off to a lab and have them measure my particle size, and they're all large. And I don't have a pre-measurement for it, so number one, I don't have a pre-measurement, which didn't make it on the first slide. And number two, I think that your LDL number doesn't matter. If you read this book, Grain Brain, older women with the highest cholesterol, do they live the longest or live the shortest? The longest. In a woman, the higher cholesterol is, the longer she lives. And at the same time, there's an epidemic of, I'm not going to say that. At the same time, there are all sorts of elderly women who may not have even had a heart attack or a stroke who are being put on statins to lower their cholesterol. So,
Well, the reason why I asked is because I've been told about my cholesterol from just my, normal medical doctor. My HDL was above what was the recommended number, but because he thought my LDL was high, he, said, somewhat high. But then my chiropractor had said, well, that's not necessarily the case, so I was just curious.
well, I recommend you listen to your chiropractor.
Do what?
I would recommend you listen to your chiropractor.
Okay, I just,
But
I just had no idea, and then my husband's like freaked out. Oh my gosh.
let me tell you what to do to put your mind at ease. So I think you probably read Wheat Belly because you recognize William Davis. You can send off your blood to get particle size measurements done. There's two problems with LDL. Number one, LDL is a calculated number. When your doctor in town does your LDL, they actually measure your triglycerides and your HDL and your total cholesterol, and then they do subtraction to get a calculated LDL number. And so the calculated LDL number is just a calculation. It may or may not be correct. So you can have your LDL measured directly and the particle size measured directly by sending it off to a lab, and you just ask your doctor to do that for you. If you'll email me, I think you can just contact me via the website, but if you'll email me, I'll tell you where I got mine done. And it costs $100. They said, well, insurance isn't going to cover it, and I was like, oh man, is this going to cost $500? It costs $100. So I can handle that. I kind of avoid a lot of talk about LDL because you could do 3 hours on it. Basically, large fluffy LDL is healthy, small dense LDL is unhealthy. In women, the higher their LDL is, the longer they live. Yes, ma'am?
How long does it take to get wheat out of your system? You said your son here, his wheat without felt better. How long?
For him it takes about 3 days. It takes about 3 days. And that's, wheat is mildly addictive. From both the sugar high that it gives you, your blood sugar, and also wheat contains these things called exorphins. So it's mildly addictive, and so some people can feel, when they cut the carbohydrates out of their diet, they cut the wheat out of their diet, they can feel a little slow or a little draggy for up to a week or 10 days. Yeah. What happens is your body is running all of its metabolism by sugar. It takes the wheat, the potatoes, all of those refined carbohydrates, turns it into sugar, and your body's runs the sugar. Well, if you cut the killer carbs out of your diet completely, your metabolism has to shift. It has to all turn backwards. And people, they feel a little bit weak, and the reason they feel weak is because they're losing fluid. And the reason they're losing fluid is because the insulin from the carbohydrates in your diet was giving you high blood pressure. By losing the fluid, your blood pressure goes down. So feeling a little bit weak is actually a good thing. It's a sign that your body is normalizing back to regular metabolism. It's a sign that your blood pressure is going down. It's a sign that you're losing all that excess fluid that you've been holding on to. Can somebody tell me it's fine still? Because I don't have a watch up here. Yes, ma'am.
A year ago, I was diagnosed with the non-alcoholic fatty liver. He told me that the only way to take care of that was exercise. Is that true?
No.
Because I'm hearing...
This is what happens. This is the way that your body works. I'm going to go over here, Nicole. You have a... This is the way that your body works. What time is it?
9:45.
Sorry, I should have had my deal, but I don't. The way your body works is you take carbs. These are the killer carbs that we just talked about. You're going to take these carbs. The carbs go into your body, and they go into an organ called the liver, okay? And what your liver does is your liver turns all of these carbohydrates into triglycerides, okay? And then those triglycerides are what get transported out to your fat tissue that you store as fat. Well, the carbohydrates get packed. They get packed in your liver as triglycerides, and you end up with this fatty liver disease. So what you want to do is you want to turn this whole process backwards, and the way you turn the process backwards is cutting the carbohydrates out of your diet. You can eat all the fat you want, and the reason you can eat all the fat you want is because now what your liver's number one function, the number one thing your liver does is burn fat. Okay? So the reason people get skinnier when they cut the carbohydrates out of your diet is you're burning your fat that you're storing in your belly, on your thighs, wherever. You're burning that fat. You're burning the fat in your diet, and you're burning the fat in your liver. So if you have fatty liver disease, you should cut. I would do like serious carb restriction for fatty liver disease, down to maybe Atkins diet style carb restriction, like 20 carbs. Burn that fat out of your liver. It just turns your metabolism backwards. And the thing is, your metabolism can either store fat or it can burn fat. It can do one or the other, but it can only do one at a time. And what determines whether you're doing one or you're doing the other is insulin. If you eat the carbohydrates, your body secretes insulin, you store fat. You're storing the fat in your liver. You're storing the fat in your waist. And if you're not eating the carbohydrates, your body's not producing the insulin, then it's going backwards and you're burning the fat out of your liver and out of your peripheral tissues. So, I would do some research on the internet about low carbohydrate, high fat diet for fatty liver disease, or LCHF for fatty liver disease. There's probably a lot of information out there. Other questions?
What do you think about all the talk about people saying how eggs are so bad for your cholesterol? Obviously, you said cholesterol in women is great, but there's some things that came out that says, one thing I saw, this has been several years ago, I've never believed it, they're like, eating so many eggs is equivalent to smoking a cigarette, stuff like that, which I thought was crazy, but.
Eating wheat toast is equivalent to smoking a cigarette. Eggs are perfectly healthy, okay? An egg is a whole food, it's a complete food. The fat that's in the eggs is the fat that you need to power your brain. The cholesterol that's in the eggs is cholesterol that you put into your brain. It contains all the vitamins and minerals that you need. An egg is a wonderful food. It has 0 carbohydrates. I would eat eggs every day. What happens is this, we'll go over this in the next hour. There are population-based studies where they say, well, this population who has cancer, let's look at them. And they look at them and say, oh, they eat a lot of eggs. Or the next time they look at them and say, oh, they don't eat a lot of eggs. And so the media puts out a headline that says, eggs linked to cancer. But those population-based studies, they can only show association. They never show causation. In order to show causation, there would have to be a clinical trial where they fed people a dozen eggs every day for 10 years and saw what happened to them. And so you should be convinced by your own results and your own diet and not be convinced, not listen to the media. The media is gonna confuse you because their job is to give you controversial headlines every day. Their job is to sell products, and their job is to actually give you, if they give you a headline the next day that's opposite to the one they gave you the day before, they're going to get more interested in the story. So if they tell you eggs are healthy and the next day tell you eggs will kill you, they're going to get more interested in it because it causes cognitive dissonance. It doesn't make sense in your brain because you think you just heard the opposite thing, so you're going to watch their show. So eat the eggs, be convinced by your own results. Your body knows what to do. Eggs contain saturated fat and cholesterol, and your body knows what to do with those things. Your body does not know what to do with trans fats, which are partially hydrogenated oils. Your body does not know what to do with polyunsaturated fats. Polyunsaturated fats are what are in corn oil, the vegetable oils. You can have a whole other discussion on polyunsaturated fats. But eggs contain saturated fat and cholesterol. Your body knows what to do with that. No problem. Yes, ma'am?
What about people that are doing raw milk, the non-homogenized, non-pasteurized milk? Is that healthy for you as well as raw eggs and stuff like that?
We have chickens in our backyard. So we just, we get our own eggs from our backyard, but we don't eat them raw. Raw milk, I would say that basically that's beyond my area of expertise. The good thing about raw milk is that raw milk contains bacteria in it that help you to digest the milk. And it's been, a lot of people have relief from allergies and different things by doing raw milk. But I'm neither here nor there on it. I don't think that raw milk by itself is going to transform your life if you're still eating killer carbohydrates. Let's take a break, and we'll start right back at the next hour.